Georgia could be first state to test Trump health proposals. Atlanta, AP, Georgia could be the first state to test multiple proposals from President Donald Trump that would dramatically change the market for insurance under the healthcare overhaul passed by his predecessor. Supporters say the proposed changes to former President Barack Obama's Affordable Care Act would give individuals and families less expensive coverage options, a particular benefit for those who don't qualify for federal subsidies to cover premiums. Critics say it would drive up insurance costs for older and sicker people. Georgia Governor Kemp issued his plan, dubbed Georgia Access, in October. It includes 3 approaches promoted by the Federal Centers for Medicare and Medicaid Services, or CMS, in November 2018. State officials plan to submit a formal proposal to the Trump administration on Friday and expected to hear by August 2020 whether the state has permission to implement it. Passed in 2010, the Affordable Care Act, Obama's signature healthcare law, extended insurance coverage to millions of Americans by expanding Medicaid and subsidizing premiums for individuals and families who make up to 4 times the federal poverty level. The law, also known as Obamacare, allows states to seek waivers from the federal government to change certain provisions, but only if they adhere to strict rules. The Trump administration has loosened those rules at the same time that they're part of a legal battle to entirely overturn the ACA. The Trump administration has sided with mostly GOP-led states, including Georgia, that are arguing the whole health care law is unconstitutional, but it has also left the door open for judges to keep parts of it. Under Georgia Access, the state would take charge of federal subsidies for Obamacare and make them available to people who buy health plans that don't provide the full array of benefits that the ACA requires. Health policy experts say that change would drive up ACA premiums by drawing healthier people to less expensive, skimpier insurance plans. That would leave the ACA with a sicker patient pool. Essentially, Georgia is saying if you're a healthier person who doesn't need maternity care or mental health care, you get to win with these cheaper products, but if you're a sicker person who needs comprehensive benefits you could face much higher premiums, said Sabrina Corlett, co-director of the Center on Health Insurance Reforms at Georgetown University's McCourt School of Public Policy. Corlett said Georgia is the first state to attempt to implement many of the Trump administration's 2018 proposals. At a recent public hearing, Carrie McSee worried about what effect Georgia Access would have on her daughter, who has cystic fibrosis. The University of Georgia Jr. needs constant medical treatment. For more on this story, visit the news article link.